Thank you, Madam Deputy Speaker, and can I congratulate the Honourable Member for Winchester for securing this debate. And I want to also echo his thanks for the work of all the health and social care staff out there who are doing incredible work in very difficult circumstances, because, Madam Deputy Speaker, what we do know is that our NHS is broken. And whenever MPs from across this House come to me with issues affecting their constituencies, I repeat the same mantra, that this government will be honest about the issues facing our NHS and we will be serious about tackling them. Lord Darcy has already completed his review of the current state of the NHS, and his report laid bare the true scale of the challenges facing our health service. And so we will not sugarcoat the problems faced by the health service in each and every part of the country, because colleagues from across the House are right to raise issues with me, and we will fix them together. We've already launched our national conversation on the future of the NHS, and we want patients, families and staff to join this conversation and to make their voices heard. And if you've not already gone on there, it's change.nhs.uk, and please let's have some sensible suggestions and not necessarily firing the Secretary of State out of a cannon. But Madam Deputy Speaker, that's not all. In her spring budget, the Chancellor of the Exchequer announced an extra £22.6 billion to protect NHS day-to-day spending. Every penny of this investment will come alongside vital health reforms, two sides of the same coin. And as the Secretary of State outlined last week, it is this government's intention to publish a league table of providers, allocating the best talent to the most challenging areas and ensuring that there are no rewards for failure. Where it's necessary, we will remove failing managers, and where senior leaders successfully improve performance, this will be rewarded. Absolutely. I mean, look, I'll try and be as unpartisan as I can be, but the hospital programme we inherited from his government did not have anything like the money backing it up, and they can shake their heads, but this is true, nothing like the money backing it up in order to bring forward those hospitals. And as I've said already, we will review that. It is our intention to bring forward these schemes, but it has to be done in a way and in a programme that is achievable with the finances to back it up. And when we announce to the House how we are scheduling the hospital programme, I expect that all the answers the Right Honourable Gentleman wants will be there. It is our intention to bring forward the hospital building programme, but it has to be done with the money. We can't build it with fresh air. Returning to primary and community care, Madam Deputy Speaker, our manifesto commits, as I say, to moving towards a neighbourhood health service with more care delivered in local communities to spot those problems earlier. We will bring back the family doctor by incentivising GPs to see the same patient so that ongoing or complex conditions are dealt with effectively. In doing so, we will improve continuity of care, which is associated with better health outcomes for patients. And our plan will guarantee a face-to-face appointment for all those who want one, to deliver a modern booking system which will end the 8 a.m. scramble, which is crucial to improving access to general practice. On dentistry, the Honourable Gentleman rightly raised the huge problems in his area, which are not that uncommon across the whole of the country. I don't believe that the previous government's dentistry recovery plan went far enough. There were too many people still struggling to find an NHS appointment. We are working to ensure that patients can start to access additional urgent dental appointments as soon as possible, and we will be targeting the areas that need them most, the so-called dental deserts. Integrated care boards have started to advertise posts through the Golden Hello scheme. This recruitment incentive will see up to 240 dentists receiving payments of £20,000 to work in those areas that need them most for 3 years. The common reason that children aged 5 to 9 are admitted to hospital, and this is absolutely shocking in the year 2024, is for tooth decay. We will work with local authorities to introduce supervised toothbrushing for 3 to 5-year-olds in the most deprived communities. These programmes are proven to reduce tooth decay and to boost good practice at home. To rebuild dentistry in the long term, we will reform the dental contract with the sector, with a shift to focus on prevention and the retention of NHS dentists. To be fair, it's something that all governments, going back to the Labour government that introduced the dental contracts for the right reasons, but in 2010 we recognised that the dental contract wasn't working in the way we envisaged and had to change. It's just shocking that 14 years have passed since then and no real action has been taken, and we are determined to fix that. At the same time, we will not wait to make improvements to the current system where these can increase access and incentivise the workforce to deliver more NHS care, and we are continuing to meet the British Dental Association and other representatives of the dental sector to discuss how we can best deliver our shared ambition to improve access for NHS dental patients. In terms of pharmacy, of course, we want to take pressure off GPs by increasing the services offered in community pharmacies. There's so much more that our pharmacists could and should be doing to deliver basic healthcare services on the high street, in the community, part of that shift from hospital to community, freeing up thousands of GP appointments where people basically don't really need to see a general practitioner for the kind of conditions they have. We are committed to look at how we can further expand the role of pharmacies and better utilise the clinical skills of pharmacists as more become independent prescribers, and that's where the potential gets really exciting. Now that the budget for government has been set, we will resume our consultation with Community Pharmacy England shortly. I'm unable to say more until these have been concluded, and I hope members will understand, but suffice it to say, Pharmacy First and community pharmacies have a huge role in improving health outcomes in the community. It's true to say that every Labour government has inherited an NHS in far poorer state than that which they bequeath to their successors. And it turns to this Labour government to fix our NHS once more.